what more do we know about when some of these vaccines will be ready? Are we concerned about the side effects? And when can we actually have something that's viable for the population at large?
Yeah, right now the vaccine studies are looking at what we call phase 1 vaccine studies. These types of studies are really looking at the safety and whether or not we actually see a response. So does the immune system respond to the vaccine? So that's not testing efficacy, meaning is it effective at preventing the virus from occurring if we have the vaccine? So those studies come next. And really importantly, that's why we're continuing to project timelines of at least 12, if not 18 months away.
Dr. Farley, the raging debate this morning is in your wheelhouse. You are one of the nation's experts on Staphylococcus aureus, methicillin, and all the resistancies in hospitals. The arch fear of medical experts is a secondary bout of this virus down the road. Explain the likelihood and how it will demonstrate if we get a virus come September or December or even into 2021.
Yeah, certainly. Well, we're looking at estimates of antibody right now that are emerging that suggest that 5% of the population, for example, the data out of Seattle and the Washington state that suggests that 5% of the population may have been exposed and recovered. So the first question, obviously, is does those antibodies they recovered from lead to any form of attenuation or protection in the future? The second question is if that's so, that still leaves 95% of the population who what we would say are immunologically naive, meaning no prior exposure and recovery. So in other words, if we roll back social distancing too fast, we continue to propagate virus in the community. That then subsequently leads us into the season of cold and flu, which is, like you said, September and on, in the United States at least, and in the northern hemisphere, that timeline. Then we also get other respiratory viruses reemerging, such as influenza. And it complicates our scenario, as was mentioned by the CDC Director, Robert Redfield, because then clinicians are seeing a patient with respiratory symptoms and scratching their head saying, well, is this flu? Is this coronavirus? Is this, another? Problem with that becomes we know how to treat flu. Obviously, we know how to diagnose it. We know how to prevent complications in most circumstances, not all. Yet transmission parameters and dynamics do affect the way we may respond. So again, we're concerned about co-occurring respiratory viruses in the same season, which will complicate decision-making. And it's not exactly that we don't anticipate coronavirus to return during the fall. We absolutely expect a second wave of infections to occur. We've already seen it around the world in various sites that have reemerged